Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Sitting in for Pinky Webb, I'm Tanjuatco-Trillo. Today on the program, President Rodrigo Duterte warns of more stringent restrictions due to the threat of Delta COVID-19 variant. The Health Department reports 35 cases of the Delta variant, but the DOH admits that there could be more. And later, OCTA Research Group fears there is already local transmission of the highly contagious Delta variant. They urge the government to place Metro Manila in a bubble. Health spokesperson and Undersecretary Rosario Vergeire joins us live. President Rodrigo Duterte says the government may reimpose stricter restrictions amid the threat of the Delta variant. In a speech on Monday, the chief executive ordered the Interior Department and the police to implement the existing protocols with greater urgency and necessity. Here's the president in his own words.
As of July 16, the Department of Health has reported 16 new cases of Delta variant in the country. That should give us, put us in grave concern because sabi na nga na it is aggressive, vicious, and more virulent and can cause death faster than the COVID-19. So yan ho ang worry natin. The reported local cases in the country is a cause for serious alarm and concern. We may need to reimpose stricter restrictions to avoid mass gathering and prevent super spreader events.
Let's go straight to the source of the story. Health spokesperson and Undersecretary Rosario Vergeire joins us now. Good morning, ma'am. Thank you so much for being here.
Good morning po, ma'am, and good morning to all of you.
Okay, so much talk about the Delta variant, no? So I want to concentrate on that first. Now, 3 of the 35 confirmed Delta COVID cases have passed away. Ma'am, based on your investigations, would you attribute these deaths to the nature of the variant, or did those who died have pre-existing conditions? I know most of them were seniors.
There are a lot of factors when we try to assess this kind of situation. We cannot solely attribute this for now with the Delta variant because one is a senior citizen and the other 2 are more than 50 years old and one has comorbidity. So we are still trying to determine, we think that it is not really solely because of the variant. There is also delay in consultation, like the 58-year-old from Manila has consulted after 5 days of having difficulty in breathing.
I see. Okay, we have several more cases remaining. What do we know of their status? Are they fully recovered? How many are in isolation? Are there any in critical condition?
For these 35 total cases in the country, we have 3 who has died, which you have just said, and then we have 7 who we discovered that are still active for now. So let me just explain this. Initially, the local governments will tag them as recovered based on the completion of this 14-day isolation or quarantine and having negative tests after. But most of them were not able to be tested after the 14th day. When we went back, because we were able to determine that they had the Delta variant, we retested again and we found that 7 among these local cases have positive results. So we immediately quarantined and isolated all of them so that we can closely monitor. But their CT values are high already, so we are trying to assess right now and discuss with our experts.
Right, you said there's 7 active cases, tama po ba? Everyone else is recovered?
Yes, everybody else is recovered. It's just that these 7 local and one and an ROF or returning overseas Filipino has tested positive. So upon retesting right now, so we are now closely monitoring that.
Okay, so these 7, ma'am, where are they? Are they in isolation? Are they in hospital?
They're all in isolation, ma'am. They are all being closely monitored by their respective local governments.
All right. Now, when it comes to contact tracing, we know that we cannot emphasize enough how key that is in controlling a pandemic. Where are we with contact tracing, and are we acting fast enough to control the Delta variant?
Well, for now, we are doing collaborative efforts. So during the time that we initially detected these 11 local cases, we had a meeting with the other national government agencies concerned, as well as with the local governments, and we emphasized on contact tracing. So they have deployed additional so that we can be able to do intensive contact tracing. And yesterday, the local governments have submitted to us initial results where they were able to already contact trace 47 among all of these 11 cases that we have identified. So it's just 9 actually, because 2 died. And we are still trying to await the other submitted reports.
Do you feel, Yusek, at this point that we need to augment the number of contact tracers that we currently have?
Well, for now, the local governments are really requesting not to augment, but to extend the contracts of their contact tracers, because apparently until the end of August yung kanilang contract, and it has to be renewed after that because they will not have any contact tracers at all. So we had a town hall yesterday with the Region 6 officials, the whole all provinces and the different barangays and municipalities, and that was the call. And DILG was there, and DILG was saying that they will try to find funds for this through the Bayanihan 3. So hopefully the Bayanihan 3 will be enacted.
Okay. So just going back to what you were saying, Yusek, about the 7 currently active cases. So dati ba po sila considered recovered and then they were let back out into the community?
No, ma'am. They were isolated or quarantined right after they were detected as positive, not yet with the Delta variant. So they were able to finish their 14 days isolation. They do not have symptoms anymore. But when they were detected with the variant, we went back to these different individuals, the local cases, and the returning overseas Filipinos as part of our protocol. And we retested, and 7 of them was positive during this retesting. So they are now in isolation and they are being closely monitored.
Okay, so they were never released into the community from the time that they finished their 14-day quarantine to the time that they were retested.
Most of them, ma'am, has never interacted with the community yet because it's still part of their close monitoring with the local governments.
Okay, so is the standard procedure now na kapag nalaman na Delta variant pala yung nakuha ng isang pasyente that you will retest them?
Yes, ma'am. This is a protocol that our experts have recommended, that whenever an individual will test with a variant and they have finished already their isolation or quarantine for 14 days, we need to go back, we need to assess, we need to retest them, and we need to isolate them until we get negative results.
Okay. Now, regarding these 11 local cases, you're not yet calling that local transmission. Can you help us understand the difference between local transmission and what is not? And what are the conditions that need to be satisfied in order for there to be transmission of the Delta variant?
Yes, ma'am. No? So initially, we said it's local cases. We are trying to differentiate this from returning overseas Filipinos because we have to understand where the infection came from. So these are local cases, 11 local cases. Now, the difference between local cases and local transmission would be these local cases that we have right now are kind of sporadic, where they are in different areas and different timelines for getting infected. So when you say it's local transmission, there is already an evidence of linkage between and among these individuals who are positive with the Delta variant. And that is what we are trying to determine right now. We need evidence so that we can be able to pronounce or to declare that there is already local transmission. But as what we always say, let us try to assume already that there is this local transmission so that we will be more cautious and our response will be anticipatory.
Right, because I believe OCTA Research, no, si Professor Guido David, he actually said na posible talaga na may local transmission, di lang natin alam exactly where. Of course, one thing that would give us a clue to that is genome sequencing, but I believe we're only sequencing about a 1% sample, right? Where do we need to be in terms of genome sampling so we get a more accurate picture of which variants are in the country and where?
Well, actually, when you look around the experiences across the globe, it's quite varied, and there are really no ideal thresholds for this. But WHO once said that if you are sequencing at least 5% of your positive samples in your population, and then maybe you are at that level where it is already rational, and you can be able to detect these variants across the population. Right now, we are doing purposive sampling, where we are identifying or collecting samples from those areas where there are surges or increase in the number of cases, or where there are increase in hospitalizations or severity of the disease. So that is what we are doing right now, owing to the fact that we still lack that capacity from our Philippine Genome Center.
All right, we still have lots of questions to ask you about genome sequencing, USEC, but we will be taking a very short break. This is The Source on CNN Philippines. Stay tuned. You're watching The Source on CNN Philippines. Our guest today is Health Spokesperson and Undersecretary Maria Rosario Vergeire. Ma'am, good morning once again. Before the break, we were talking about genome sequencing. You said the WHO recommends to sample at least 5% of the population. Philippines is currently sampling only 1%. Can we get to this 5%, and what would it require?
I'd just like to clarify, it's 5% of the total positive samples in the population.
Yes, ma'am.
And how to get yes, ma'am. We are now investing in resources so that we can expand our capacity. Of late, we were able to provide funds to the Philippine Genome Center so that they can procure more reagents, and we can be assured that we have reagents until the end of the year. We also have helped them or assisted in procuring the extraction machines. This is for them to be able to fast track their process in the sequencing process. So if we will be able to receive already these extraction machines, we can double our outputs already. Currently, our capacity is 750 samples per week. We can do as much as 1,500 samples per week. And the third, we are trying to expand through the network of the University of the Philippines in UP Visayas and UP Mindanao, where we can be able to have strategic sites for this sequencing process. And we are trying to invest on that so that we can be able to increase our threshold or our capacity, that we may be able to facilitate whole genome sequencing across the country.
Right. As you mentioned, location is actually quite important. There is a proposal to conduct genome sequencing in areas where the cases are quite high. Is this something that is possible or will be possible?
That is already what we are doing. As I've said a while ago, we are doing purposive sampling. And what we are trying to prioritize for our samples to be sequenced would be from those areas with experiencing surges, and we cannot see factors that will really contribute to this rise in cases. So like, for example, in Western Visayas and also in Iloilo, we were really wondering why we cannot manage the cases for so long already. It has been weeks, and the cases are still plateauing or increasing. And so we did sampling among these individuals in their area, and we found that there were variants of concern. That's why there is this increase in the number of cases.
Ma'am, are you able to share with us the location of the 7 active cases of the Delta variant that you mentioned earlier? Where are these cases?
These are from Cagayan. We have in Manila. We still have a positive case in Manila. And then we have in the different areas of the country right now. Like we also have in CDO, in Misamis Oriental, and also in Ermita, Manila, as I've said a while ago.
All right, ma'am. Now, IATF co-chairperson Carlo Nograles, yesterday, when speaking about the Delta variant, he said it changes the rules of the game. Those were his words, no? Are there going to be any changes in government policies in general?
In general, we are still going to implement what is existing. So maybe we are just going to heighten whatever we are doing, because according to experts and even based on experience, whatever protocols that we have right now is what we need to do. We just need to intensify them. Now, as to the restrictions, based on what we are now trying to discuss with our experts, that is what we are going to discuss with IATF. We met with our experts yesterday, and there were some recommendations already, and then we are going to meet them again tomorrow so that we can finalize a recommendation to the IATF.
Okay, ma'am. Another thing about this idea of genome sequencing and sampling is the time, no? So we had Manila Mayor Isko Moreno yesterday lamenting the fact that when they received information about the Delta variant in his city, the data was 3 weeks old. So it would seem that they really lost a window of opportunity there for contact tracing and such. What can be done to speed up the process, po?
We need to understand that we are also highly reliant with the local governments with their submission. Second, we need to prioritize samples. As I've said, we get samples and prioritize them for the 750 run from among all of these areas that are having increase in cases. Now, for example, their samples were not included, but the city value is qualified to be sequenced. We do biobanking. So we store them and then maybe test them for the following week. So this is why we have this kind of delays in the detection because of this process. But right now, what we are trying to do is we are getting a more updated or more timely sampling from our local governments. And we already announced this to them so that they can send these samples that are on time so that we can easily do contact tracing and the case is still in that active phase and we can do the contact tracing immediately.
Okay, ma'am. Now, you mentioned that in your meeting, there were several recommendations made with regard to trying to contain the Delta variant. Are you able to share with us, po, what these restriction recommendations are?
Again, ma'am, I'm sorry, I did not get it.
Yes, you said you met earlier with other officials regarding more restrictions and recommendations with regard to the Delta variant. Are you able to share with us what those recommendations are?
Well, I cannot tell you right now because we need to elevate this to the IATF. What I can tell you would be that we have assessed and tried to discuss the community quarantine classifications across the areas identified with the variant. Second, we also were able to discuss about the age restrictions across the local governments affected. So these are the things that we are going to further study, especially with the other government agencies included into our data analytics group, and then we will be presenting in the IATF on Thursday.
On Thursday, po. Okay, it is time for us to take another short break, but please do stay with us, USEC. We will be taking a short break. This is A Source on CNN Philippines. Stay tuned. You're watching The Source on CNN Philippines. Our guest today is Health Undersecretary and Spokesperson Maria Rosario Vergeire. Ma'am, good morning once again. There is a lot of fear surrounding the Delta variant and its possible impacts here in the Philippines. Do you see the need to expand the travel ban from other countries?
Well, this is something that IATF has to discuss and to resolve. The recommendations would be presented to them on Thursday. But one thing is this is being highly considered by our officials owing to the fact that we see right now other countries being ravaged by this Delta variant and their risk classification according to the guidelines of CDC is really at that high risk. So this will be discussed on Thursday with the IATF officials.
All right. Now, OCTA Research has said that the surge that we experienced in March, that might even just be a walk in the park compared to what might happen if the Delta variant really takes hold here in the Philippines. How is the DOH preparing for this possible surge? Where exactly are you concentrating your efforts in preparation for such a surge?
Well, we're concentrating both in the community and in the facility. So ever since India had this kind of experience, we started coordinating with our local governments already and the other national government agencies. So for hospitals, we are concentrating on our accordion policy where they need to expand whenever there are surges. But we have instructed them not to wait for the increase in the number of cases. Let us try to prepare right now. So we already have coordinated with our hospitals, coordinated also with the private sector so that all of the hospitals will be prepared We have mapped out the inventory of oxygen supplies in the country. We have coordinated with the Department of Trade and Industry so that they can talk to the manufacturers to somehow produce more of these oxygen. Currently, our oxygen supply is sufficient according to all of our hospitals. But of course, when we have the Delta variant and it's going to increase the number of our cases, we will be requiring twice as much. So we are now trying to prepare for that. We also are pre-positioning logistics already, downloading funds to our hospitals and regional offices. As to the community, we are now coordinating with our local governments. We're having town halls, we're having mini conferences with them so that they can be guided and intensify their PDITR response. What would be most important right now is for them to shorten the duration between their detection of a case and their isolation so that we can cut transmission in the community. And of course, what would be most important right now is for them to ramp up vaccination. Those fully vaccinated have been shown based on evidence that they are more protected from these variants versus those who are not vaccinated at all.
Sure, ma'am. Now, when it comes to manpower, how are we preparing for that? Because, I think, certain organizations are already saying that we don't have enough nurses.
Yes, we are doing this emergency hiring and it is still continuing. We have also downloaded funds to our regional offices to provide assistance to our hospitals in the respective regions that they can be able to hire additional human resources. So this is very critical, especially when there would be increase in the number of cases. That's why as of now, we already have instructed that you should be able to augment already your health human resources. We also have reviewed our policies, especially regarding quarantining of our healthcare workers when they get exposed. And based from evidence and expert recommendations that we can be able to revise this protocol to shorten the quarantine since most of our healthcare workers are already vaccinated.
All right, ma'am. Now, what is your view when it comes to repatriating Filipinos? Because we do see a lot of the Delta variants coming from returning OFWs.
Repatriating Filipinos is one of the major programs of our government, and this is priority for our president. So we are not to be worried about that. It's just that we need to ensure that protocols will be followed. So when we repatriate Filipinos, we are very certain because they are under our care and we do the precise quarantining procedure among them, and we do not release them until we are very sure that they are not infected or they do not have symptoms. And we cannot endorse them to the local governments if we are not sure that they are not infected.
All right, ma'am. OCTA was recommending that the NCR and its surrounding provinces be put in a bubble once again. Do you think this is something that could happen?
This is something that will be discussed with the IATF, of course, as what Cabinet Secretary Nograles has mentioned, that some protocols maybe need to be heightened or intensified. And this is one of the things that we need to discuss with them. But let us remember, we need to be objective because there are certain parameters that we use for this community quarantine classification and this type of bubbles that we have. So we need to look at still the trends of cases and also their healthcare utilization. We need to be able to encourage our local governments that they can do granular lockdowns instead of locking or doing this bubble for a whole region, which is really which affects really our economy. So what we are going to do right now, we are guiding our local governments that they intensify these granular lockdowns, this PDITR response. They have to enforce and they have to have visibility in their community so that people will comply also with the minimum public health standards. So what our experts are recommending right now is objectivity in this time of this situation. We need to still have evidence before we can be able to recommend this kind of community quarantine classifications across the different areas of the country.
Right, base it on the data. Ma'am, I want to talk about the situation in Bicol. As you know, there is a tugboat and a barge carrying COVID-19 patients who recently traveled to Indonesia, and they are going to dock in Albay province. Is this a good decision?
Yes, ma'am. So this case has been or this incident or event has been already reported to us, and we were able to discuss this with the regional director of the DOH. Actually, the barge is there already in Legazpi City, and they are closely monitoring the different individuals who turned positive. And one of the things that they have reported to us would be that based on monitoring, if anybody of them will have symptoms, they will be immediately referred to the hospital nearby in Bicol.
Right. Ma'am, would you see the need to do genome sequencing on their samples?
Definitely, ma'am. Definitely. They're coming from this high-risk country. And most of them, 12 of them actually, out of the 20 who are in the vessel, turned positive, and they came from Indonesia. And when they came here, they were swabbed, and these samples are already being processed to be transported to the Philippine Genome Center.
All right, so we shall find out in good time which variant they have. Yusek, thank you so much for joining us here on The Source. We always appreciate your time. Thank you for making CNN Philippines part of your morning.
Thank you very much.
So that was Health Spokesperson and Undersecretary Maria Rosario Vergeire. Thank you for joining us here on The Source. I'm Ria Tanjuatco-Trillo. You're watching CNN Philippines.